Hi guys, welcome back to my channel. Today we're going to be talking about concussions. But before we go any further, I do want to say that if you think you're having a medical emergency, I would like you to turn off this video, call 911, and get yourself some medical attention. But if you're just wanting to know a little bit more about concussions or you were diagnosed with a concussion, this is the place for you. Okay, so the first thing I would like to do is to start talking about what is a concussion. And to do that, what I would like to do is to look at this graphic. So let me fix my computer here so we can actually see the graphic. Um, and this is a graphic that I got from a website called Pixabay. It is a open source, royalty-free, or website that provides royalty-free open source images. So that's where I got this. So what we can see here is we can see the human head, and the image that we're looking at is if we were to cut our body in half, so our head in half just this direction, and look in, that is what we're seeing. Well, the parts that I want to kind of mention out here is this part right here, and this is kind of the skull area. So you can see this kind of these hole-ish areas. That's the hard part. That's the skull that we have here. And underneath here is we have the brain. In between the brain and the skull, we have this region. This is called cerebral spinal fluid right here. And that is kind of like a watery, somewhat oily substance that cushions our brain from our head. So in normal day activity, if someone were to call our name, we would look over our shoulder. It's going to help kind of cushion that so we don't damage our brain. During a traumatic event, so we fall, we're in a car accident, like a fender bender, and our head kind of whips back and forward. If we're in war, the big explosion, that concussive force, tree branch falls on our head. Any of those things can override that defense mechanism they have with the cerebral spinal fluid. So if we have this action where our brain moves this direction, runs into the skull, and bounces back, that can cause damage to our brain called a concussion. So what is happening how is damage being done? Well, let's look at this graphic here. This is a picture of a neuron. I also got this off of Pixabay. And these are the type of cells that make up our brain. Now, if you don't know what a cell is, I have another video that you can learn about cells. But essentially, this is the cell of our brain, and what these cells do is they communicate. So this is the body of the cell, and this is called an axon. And these little fingers communicate with other bodies of other neurons. And they send signals throughout our body, and they control pretty much everything. They control how our breathing, they control what we think, what we remember, how we see, smell, taste, feel, how we move our muscles, everything. I know there's probably some cellular biologists and neurologists out there just screaming at the computer about how simple I'm making this, but this is just kind of the gist. So these things send out these signals through this little axon, and they communicate with with other ones, and then they kind of down the stream as we do our things that we need to do. But when we have these concussions, what happens is this area right here, or here, I guess too, they can break. So they get frayed. Much like if you have a phone charger, have had it for a while, and it gets bent, and you plug it in, but you can't get your phone to charge. You have to kind of wiggle a little bit, and then there it starts charging, kind of like that. So it breaks it, so it's not as effective, or if it breaks it all together. And so what happens, instead of the signal going from here to there, it has to go up to this. It has to go up to this neuron, to this neuron, to this neuron, down to this neuron. So it takes longer, and so that can cause a lot of the symptoms of the concussion. So what are the symptoms of a concussion? Well, as we've learned, a concussion is a damage inside the brain, and the brain pretty much controls everything. So the symptoms can be really varied. You can have a headache. You can have sensitivity to light. You can have blurry vision. You could have um, nausea with or without vomiting. You can have unsteady gait, meaning you're having a hard time walking straight or feel dizzy. You can have mood changes, so like you're irritable or you're anxious or you have insomnia, so you can't sleep. You have depression. Lots of different symptoms. One myth out there that I would like to address is some people say that you can only get a concussion if you lose consciousness. And that is actually not true. You can get symptoms of a concussion a few days after the incident where you hit your head. Um, how long do these last? Usually they last a few days to a couple weeks, these symptoms. But in some cases, you can enter into a realm called post-concussive syndrome where these symptoms just persist and they can last a long, 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 long time, up to even past a year if in some cases. There was one case that this gal came into the emergency department over and over and over again because her concussion symptoms just were not getting any better. I felt really bad for her, but that's exactly what she had. All right, so let's say that you hit your head and you are wanting to go into the emergency department and get checked out. What kind of workup can you expect? Well, that is not quite an easy answer. It depends on multiple things. But first, let's talk about it's one thing out there that I hear a lot from patients that come in. Is they say, hey, you know, my mom, my daughter, my sister, whoever wants me to come in to get checked out to see if I have a concussion. Well, we do and we don't check you out for concussion. If we do any sort of workup, what we're actually looking for is a thing called a head bleed. And to explain what that is, I'm going to go back to my graphic here. And a head bleed is different than a concussion. A concussion, you know, we talked about where you have the neurons talking to each other and that gets disrupted, and so you get those symptoms. A head bleed is actually a little bit more of a serious condition. And what is you can get bleeding in kind of in the middle of your brain. You can be anywhere in the brain, but you know, in these areas, it can be anywhere. But it's where a vessel is actually breaks during that trauma and starts pooling this blood, and that blood can cause the tissue or the cells around there to actually die. And therefore someone can have permanent disability from that. They can die from it. It's a very serious condition. So when we actually work you up, we're actually looking for this, not actually concussion. Now there might be some tests out there, some really fancy scans that can show test for concussion, like where the concussion stuff is, but that's not something that we do in the emergency department. So who gets tested for head bleeds then? So what if we're getting a workup? Who's getting a workup and who's not? Well, it depends on a couple things. Like one, it depends on your presentation. So if you are let's say you're 30 years old and you come in and have your friends with you and you're laughing and talking and you're eating your chips, but then you complain of a headache and you know light bothers you, the doctor may decide not to actually do a workup. It might just say, hey, you know, it sounds like from the symptoms that you're describing, you have a concussion. Why don't we just let you get to home and get some rest? Or let's say you're the same 30-year-old and you come in and you can't walk straight and you're having a hard time staying awake, you know, not interested in the friends sitting next to you, then the doc might be a little bit more worried and actually work you up for a head bleed. Some other risk factors that doctor might decide to do a scan or blood work is if you are an elderly or very young, like a baby. They are more prone to getting head bleeds because their vessels are more fragile. So if you fall, they can bleed easier. If you are inebriated or intoxicated with drugs or alcohol, those things can lead you to get a scan or workup because are you not walking straight because you're drunk, or are you not walking straight because you're having a head bleed? So that'd be one other issue. Or if you're taking medications that make your blood, you have like a blood thinner because of a heart issue, that can lead a doctor to make that decision to work you up. If you have Alzheimer's or dementia, so you're already on a confused basis, are you having a head bleed too, but we can't see it because of the dementia or the Alzheimer's that you already have. Um, do you have any clotting disorders? Lots of different things can make a doctor sway one way or the other. So to test for that, you need what we call a CAT scan. And a CAT scan is a special imaging thing. It's a big donut like machine. It's not the big tube that people get afraid of, that they go in and get claustrophobic. This is not. It's a very big donut thing. You're open to the air. It's pretty darn quick, but it delivers radiation to you. So there's risks involved with that. You can get, with enough radiation, you can get cancer from it. So there's health issues along with that. So the doctor has to weigh, is the risk from getting the radiation from the CAT scan greater or less than the risk of you potentially having a head bleed? And that's what he has to weigh. And sometimes those doctors, depending on what they're thinking, might just say, you know what, it's not worth it to get a CAT scan. I think you have a concussion. You're okay. You can go home. Or they might have a conversation with you and say, you know, we're kind of on the fence here. I don't really think you have a head bleed, but what do you think? Which way would you like to go? And other times they'll say, nope, we're going to get a CAT scan just because of your risk factors here. So that's why the doctor might decide one over the other. All right, so you got diagnosed with a concussion and sent home. Uh, what is the typical treatment plan for a concussion? How do you care for yourself at home? So what we need to do is rest the brain. Just like if we were to sprain our wrist, we need to rest our wrist, right? If we injure our brain, we need to rest our brain. So in an ideal world, what our brain needs would be to be in a dark room that's quiet and we can just zone. Unfortunately, life gets in the way, and that's not always possible. So, what are some of the things that we can do to help ourselves get better? Well, some of the things that people overlook is how much stimuli we get through our eyes. So when we are sick, and we're sick with the flu, what is the first thing we think about doing? We think about cuddling up on our couch with a blanket and watching a movie, right? Well, with a concussion, that's not going to work because that movie is actually stimulus to our brain, which is going to make it work, and that's not what we want. So, getting on our phones, working on the computer, watching movies, all of that visual stimuli is hard on the brain. So as much as we can get rid of that, the better it will be for our brain. Reading can be hard on our brain, just like when the visual stimuli coming in. And I know that's not always possible with work or school, but we can just minimize that as much as we can. Like if you can get an audiobook on, for class or something like that, so you can listen to it. I think that's probably a little easier on your brain. It's still stimulus, but maybe a little bit easier. But just taking it easy in the dark and trying to get plenty of rest, plenty of sleep. Is another great thing for your brain. I talked about how in the emergency department we work you up for a head bleed because that's what we're concerned about. It's not to say, that's not to minimize a concussion. A concussion is still a serious thing, so we need to take care of it well at home. And so before returning to any kind of physical activity like sports or PE or even a physical job that potential to hit your head, you need to really be careful, because if you are not totally healed from a concussion and you get another concussion, what can actually happen is you can cause swelling in your brain during that second concussion, which it's rare, but it can happen and can be fatal. So we really need you to heal from that first concussion before you get back to activity. Now, how do you do that? That is definitely going to be a conversation and a plan that you work with your physician. But essentially what they might be, kind of the thought process out there right now, is you kind of work your way up in activity. So if you might start with really light activity, just walking, right? And if you tolerate that, fine. Then you work up to the next level. So you might do some little bit of jogging. But then if you start getting a headachy or nauseated with that, you might go back down to the walking for a little while and then try the jogging again. And once you do okay with the jogging, then you go into more intense workouts. And then, okay, nope, I'm still a little nauseated, and I go back down to the jogging, and I do the little jogging for a little while longer. And then, I mean, this could be a couple days sort of thing change. And then once you get there, then you get go back to practice, but you're not in full contact practice of sports, let's say, until you're totally symptom free and you're ready to go. But that again, that is definitely a plan that needs to be worked out with your doctor and under their supervision. Well, that's pretty much all I got for concussions. I hope you found this video helpful. If you did, please click that thumbs up button below and go ahead and subscribe if you haven't already. And while you're down there, go ahead and click that notification bell so you can know when I send out any new videos. Well, I hope everyone stays healthy, and I will talk to you later.